Welcome back to Suncoast FYI. I'm Kathy Leone. Fyzical Health is building a comprehensive balance therapy program that not only helps people to live longer, but to live better. And here to tell us more about it is Dr. Vivian Pomachun and Dr. Dan Deems. Thank you guys for joining us.
Thank you for inviting us.
I guess we should start with a little bit about your guys' backgrounds. Dr. Deems?
Thank you very much. I'm Dr. Dan Deems. I'm an otolaryngologist, ENT physician. I've been in Sarasota now for 18 years, and my partner, Dr. Pomachun, we've been together for 3. I'm an otolaryngologist. I trained at the University of Pennsylvania, and I also did a PhD focused on balance and vestibular orders from UCLA, and we brought that to the Suncoast.
Wonderful. And
Hi, Kathy. My name is Vivian Pomachun. I'm a ENT, just like Dr. Deems. My patients call me Dr. P. It's a little bit of a mouthful. But my training was at Tulane University Medical School. I did my residency at the University of South Florida, the Moffitt Cancer Center, and Tampa General Hospital. And we are here to discuss our practice. We treat all ear, nose, and throat conditions, but lately we've decided to focus and specialize on the treatment of balance disorders and falls prevention, because this is a growing problem in our country, and we have taken a proactive approach at helping people achieve a higher quality of life and to prevent injuries from falls.
so that is your focus, and then that is your mission then, is to be the proactive.
Right. Our focus, Fyzical Health, Fyzical, is a new division of a national company called Physical Therapy and Balance Centers, now present in 30 states. And it's a collaborative approach to take a proactive approach to healthcare. You know, in medicine these days, we treat things in a reactive fashion. Individual falls and breaks something or has an injury, and we take care of it after it occurs. And our plan for Fyzical Health is to combine our medical practice with the good healing hands of physical therapists to actually prevent those disease processes from happening.
That's wonderful. So then what type of patients and conditions do you treat?
Well, this new expansion is designed to help those at risk of a fall and suffer injuries from a fall. Some statistics that we found staggering were 1 in 3 Americans over 65 will fall each year. That's 14.3 million people last year fell, and 27,000 people died from injuries sustained from those falls. This is an entirely preventable problem. We'd like to have these people come to us so that we can do an assessment of their function and outline a therapy program that allows them to avoid being injured from falls, avoid death. We'd also like to attract people who are limited in their quality of life because of balance problems. There are people that aren't able to attend social functions or family functions, aren't able to play with the grandkids or their children because of these life-limiting conditions. We can treat these people with a proven surgery-free, pain-free method that allows them to get out and be social. These problems often lead to dementia. They often lead to social isolation and depression, and we don't want that. Our goal as physicians is to make people better, not just live longer, but live better and love their lives.
So then what is so different about your approach?
So our approach is a unique collaboration between medical specialists such as ourselves and the good healing hands of the physical therapist, nutrition approach, and business gurus who put together a model that helps take this preventative approach to falls and imbalance. So for instance, in the clinic, what's unique about it, every person is harnessed to the ceiling, and there's like a railroad track that runs through the center, so an individual can't fall. In fact, when I'm inviting my patients to come on board, I say you can fly through the clinic like Peter Pan. And that's true, because individuals don't like to do physical therapy and things because they're afraid of falling, and that's what challenges most individuals. But you can go through this pain-free methodology and really improve your balance to prevent those falls and try to prevent the statistics that Dr. Pomachun was describing.
So then some of the challenges that you face are?
The biggest challenge is making people aware of how serious of a health risk this is, how many injuries and how much it limits them. People often accept imbalance or social limitation as a fact of life, as a fact of aging. Doctors often only treat you when you fall, when you're in the emergency room, when you break a hip or a femur. We don't want that to happen. We want you to come in so that you can avoid going to the emergency room. We also want you to come in so that you feel entitled to live a healthy, active lifestyle. Medicine has gotten really good at making people live longer, But those later years are not always filled with joyful days. A lot of times they're filled with doctor visits. We
Right.
want you to go to your family functions. We want you to go to dinner with your friends and to have a good time. You don't need to spend those waning years alone, isolated, depressed. We want people to be better, to be well, to live better lives, to love their lives, like our motto says.
That's wonderful. So let me ask you very quickly, what is on the horizon for you guys?
So we're excited about Fyzical Health because it's a new approach to medicine, and our plan is to have a state-of-the-art balance center and concussion center. What most people don't realize that when you have a classic concussion, you also have an inner ear or vestibular concussion. And if you don't take care of both, then you can't recover from your concussion. We're collaborating with the national franchise, again, hundreds of centers across the U.S., more than 30 states, to bring together physicians, physical therapists, nutritionists, business gurus to, again, as a preventative approach, prevent disease process, improve life, and to really, our goal is to change the face of healthcare. We plan to clone this model for the rest of the country, beginning first with otolaryngologists and then spread into other specialties. Again, as Dr. Pomachan said, our goal is to help people love their lives.
That's wonderful. So wonderful and great information. Thank you guys for joining us. For more
Thank you so
information
much.
on Fyzical, we're going to put the information, your website and telephone number on the screen right now. And again, thank you guys for joining us.
Thank you for the invitation.
Thanks for having us.
All right, well, stay tuned to Suncoast FYI. We will be right back.